All right, so there are three broad types of healthcare organizations: centralized, decentralized, and product line. And pretty common sense, but I'm going to talk about those anyway. A centralized organization has less personal responsibility. Their supervisors, managers direct the nursing staff. So think a unit that has a very active full-time charge nurse. That charge nurse is at her desk, his or her desk, all the time, and they set the assignments, they direct the care, they direct workload. They're there running everything. They know everything that's going on. They know all their patients. They are centralized. Decentralized, there is no charge nurse. Nurses have a little more autonomy and authority on their own. They have more responsibility, but they're in charge of their own personality and their own person, their own team. So centralized, very controlled, frequently very uniform, but rigid. Decentralized, not uniform, not rigid, but potentially uneven. If you have a person, a nurse who's very, very focused, very driven to be perfect, great. If you have a nurse who's less focused, a little more okay, well, you're gonna have some conflict there possibly. So that's the difference between centralized and decentralized. Organized on a product line, think something like a wound care clinic. It's just one focus. Or a diabetes clinic. Or an eye surgery clinic. Everything that happens is focused on a single product. And of course in healthcare, products are actually services. So those are three types of healthcare organizations. We also look at client safety. Client safety is critical. For many reasons. First off, we don't want people getting hurt. But one of the things that you may not know, but if a patient gets hurt in the hospital while they're hospitalized, very likely the hospital will not get reimbursed for that treatment. And it's very specific about some things. If a patient develops surgical site infection, central line infection, urinary tract infection, big one. If they develop those while in the hospital will not get reimbursed for all the treatment required to bring them back to normal. This is why Foleys are almost always taken out early. In the past, if a person was in the hospital and had surgery and had a Foley catheter put in, it would stay in for a long time, and now it's usually taken out either right after surgery or within 24 hours. Also, what's done to prevent that is anybody who is coming in the hospital will almost always have a urinalysis done to check to see if they have a UTI to begin with. If a person enters the hospital with a UTI and they get a catheter put in, they're okay because they had the infection before the catheter. So that's why we so strongly emphasize sterile technique with catheter use. It's just so important. Rapid response teams were initiated because of patient safety. Rapid response are a relatively new idea, and now they're used everywhere. Things like high alert medications, having two nurses sign off on heparin and insulin and morphine for PCAs. That never used to be. When I was a new nurse, if I hung a heparin drip, I'd hang a heparin drip, I'd program it, I'd be done, and I'd walk away. Done. Now, it takes two nurses to verify everything. Insulin drips, two nurses. Blood, two nurses. Well, it was always two nurses for blood. But they're changing practices to prevent accidents. We don't want people to be hurt. It's bad for everything. I mean, remember, patients are patients, but they're also customers. And if a customer gets hurt while they're with us, that customer is less likely to come back. And not only that, what will they do? They'll tell everybody. Not only just their neighbors. They're going to get on Twitter, Facebook, and Pinterest, and Instagram, and do all that kind of stuff. And they're going to tell everybody how bad they got care at Hospital XYZ. So, as part of healthcare economics, patient safety is a key factor in keeping everyone successful. So why don't you come back in for the next section, and we're going to talk about the 5 different patient care delivery models.